Hello, my name is Hillary Sines and I am the Employee Health Assistant for Privia, North Texas, as well as the assistant to Tammy Woods, who is our risk manager. Today, I will be presenting the 2020 annual training OSHA portion. Let's get started. Flu season begins in October with its peak in December through February, although it can last as late as May. Getting a flu shot can reduce flu illnesses, doctor visits, and missed work or school due to flu, as well as prevent flu-related hospitalizations and death. Tammy and I will be administering flu vaccines to all Texas healthcare physicians and employees. A doctor's note will be needed in order for you to receive a flu vaccine if you are currently pregnant or nursing or have an egg allergy. If you choose to get your flu shot elsewhere, record of it must be submitted no later than November 1st. In the next few slides, we will review sharps, needles, and sharp containers. Needle stick injuries often occur when disposing of a needle with attached tubing. An example would be drawing lab with the butterfly. Failure to dispose of a used needle immediately into a puncture-resistant container, or working too quickly. Handing off or passing off a used needle, recapping a needle without using one-hand scoop technique. I will explain how to do the one-hand technique. You are going to place the cap of the needle on a flat surface. After you're done with the used needle, you're going to guide the tip of the needle into the cap using one hand. You're then going to take that needle with the cap on and press it against a firm surface. It's your employer's responsibility to provide needle devices with safety features, provide sharp containers, investigate all sharp-related injuries, and provide post-exposure medical treatment. As an employee, some of your responsibilities are to avoid recapping used needles, promptly dispose of a used needle device and sharps, plan ahead for safe handling and disposal, use devices with safety features. The appropriate wall mount height for a sharp container is between 52 to 56 inches to allow for view and safe access to container door. When the sharp container reaches the fill line, it's time to close it out and put a new one. Never wait until it's completely full. If you experience a needle stick or a sharps injury, or are exposed to blood or other body fluids of a patient during the course of your work, immediately follow these steps. Wash the exposed area with soap and water. Second, inform the patient of what occurred. Third, ask the patient to sign a consent form to have their blood drawn for hepatitis B, C, and HIV. You're then going to notify our risk manager, who is Tammy Woods, who will then send you down to OCMED, where they would run the patient's source and, if needed, give you medical treatment. Workers' comp. All injuries must be reported regardless of severity, even if no work time is lost. Tammy Woods must be notified immediately of all work-related injuries or exposures. She will also then ask for you to fill out an incident report for her. Next, we will review personal protective equipment and COVID-19. Before COVID, we practiced washing our hands or using hand sanitizer before we did anything. Foam in, foam out. We adopted the hospital protocol a few years ago. You call your patient back to the exam room, wash your hands or hand sanitize before obtaining vital signs. Leaving the exam room, wash your hands or hand sanitize before exiting. Putting on or taking off gloves, practice good hand hygiene. We were already wearing our lab coat while in clinic. Now, due to COVID, we have to use every piece of personal protective equipment there possibly is. First, we added a face mask, wearing the mask to cover your nose and mouth at all times. Second came the face shield or goggles. What do we know about COVID-19? It's a virus. There has been a wide range of symptoms reported, ranging from mild symptoms to severe illnesses. Symptoms appear 2 to 14 days after exposure to the virus. Here is a list of some common symptoms: fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or running nose, nausea or vomiting or diarrhea. CDC determines close contact as being within about 6 feet of an infected person while not wearing recommended PPE. Close contact also includes instances where there is direct contact with infectious secretions while not wearing recommended PPE. Close contact generally does not include brief interactions such as walking past a person. Because COVID-19 is a virus, you can be infected with more than one virus at the same time. Therefore, identifying infection with one respiratory virus does not exclude COVID-19 infection. Here are some examples of healthcare work tasks associated with exposure risk levels. Working in a doctor's office puts most, but not all, of you in the medium exposure risk level. Providing care to the general public who are not known or suspected of COVID-19 patients. Working at a busy staff work area within a healthcare facility. OSHA has developed this interim guidance to help prevent worker exposure to COVID-19. For all workers, regardless of the specific exposure risk, it is always good to practice frequently washing your hands with soap and water for at least 20 seconds. When soap and running water is unavailable, use an alcohol-based hand rub with at least 60% alcohol. Always wash hands that are visibly soiled. Avoid touching your eyes, nose, or mouth with unwashed hands. Practice good respiratory etiquette, including covering coughs and sneezes. Avoid close contact with people who are sick, and stay home if sick. You should always try to wash your hands immediately before touching a patient, before performing septic tests or handling invasive medical devices, before moving from work on a soiled body site to a clean body site on the same patient, after touching a patient or the patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, immediately after glove removal. Unless hands are visibly soiled, an alcohol-based hand rub is preferred over soap and water in most clinical situations, due to evidence of better compliance compared to soap and water. Hand rub are generally less irritating to hands, and in the absence of a sink, are an effective method of cleaning hands. Donning gloves. Again, wash your hands for at least 20 seconds or use hand sanitizer. You're then going to select the appropriate glove size. You're then going to hold with one hand and insert the other. When the base of your thumb reaches the cuff of the glove, begin to spread your fingers and insert hand into glove. Next, you'll pull the glove cuff towards your wrist to cover as much skin as possible and secure the glove. Check to make sure there are no holes or tears. For the other hand, you're going to repeat steps 3 through 5. To remove your gloves, you're going to pinch one glove at the wrist. Remove glove by pulling away from your body. Continue holding the glove you just removed in your gloved hand. Slide a few fingers of your bare hand into the cuff of the glove you are still wearing. Pulling away from your body, peel off the second glove, turning it inside out and leaving the first glove wrapped inside as you remove it. Dispose of glove safely and wash your hands or use hand sanitizer before touching any other surface. Before putting on a mask, you should clean your hands with soap and water or hand sanitizer. Remove a mask from the box and make sure there are no obvious tears or holes in either side of the mask. Determine which side of the mask is the top. The side of the mask that has a stiff, bendable edge is the top and is meant to mold to the shape of your nose. Determine which side of the mask is the front. The color side of the mask is usually the front and should face away from you, while the white side touches your face. Face mask with ear loops. Hold the mask by the ear loops. Place a loop around each ear. Face mask with bands. Hold the mask in your hand with the nose piece or the top of the mask at your fingertips, allowing the headbands to hang freely below hands. Bring the mask to your nose level and pull the top strap over your head so that it rests over the crown of your head. Pull the bottom strap over your head so that it rests at the nape of your neck. Face mask with ties. Bring the mask to your nose level and place the ties over the crown of your head and secure with a bow. You'll want to mold or pinch the stiff edge to the shape of your nose. When removing your mask, you'll want to clean your hands with soap and water or hand sanitizer before touching the mask. Avoid touching the front of the mask. With face mask with ear loops, hold both of the ear loops and gently lift and remove the mask. Face mask with ties. Untie the bottom bow first, then untie the top bow and pull the mask away from you as the ties are loosened. For face mask with bands, lift the bottom strap over your head first, then pull the top strap over your head. For goggles or face shield, place over face and eyes and adjust to fit. You're going to remove goggles or face shields from the back by lifting headband or earpiece away from face. When putting on a gown, fully cover torso from neck to knees, arms to end of wrist and wrap around the back. When removing a gown, peel away from neck and shoulders. Turn contaminated outside toward the inside, fold or roll into a bundle and discard. This concludes our 2020 OSHA compliance training. At this time, please fill out the exposure identification form. There are two categories. Our high exposure is for our physicians, nurses, and all persons exposed to pathogens regularly, and our low exposure for our business office employees and receptionists. Please be sure to circle the one you belong in and initial next to that. You'll then want to review the following tasks and procedures and check any that apply to you. Thank you.